As our economy starts to open back up here in Connecticut, there are so many questions about what's safe to do and how to handle certain situations. I am joined by Dr. Henry Anyimadu. He is an infectious disease specialist at the Hospital of Central Connecticut. Thank you so much for being with us to answer our viewer questions.
Thank you for having me, Kara.
So many viewers have asked, if I go on vacation to one of the states that requires quarantine, when I return to Connecticut, wouldn't it be possible to know if I have COVID by getting a test right away, and then I would not need to quarantine?
So you can definitely get a test, but when you return from a state that requires quarantine. But having a negative test should not replace the 14-day self-quarantine. And here's why. The incubation period of COVID-19 is 2 to 14 days. So if you get a test or a negative test on day 7, there is no guarantee that you won't have a positive test on day 14. So a negative test at any time during the incubation period should not replace the need to self-quarantine.
Okay, a lot of difference, and that's going to affect a lot of travelers. Doug from Meriden says, can COVID-19 be passed from mosquitoes to humans?
Well, to date, there is no evidence to suggest that mosquitoes can transmit the coronavirus. The virus is spread mainly through respiratory droplets generated by an infected person or inoculating your eyes, nose, or mouth with a contaminated hand.
Okay, good to know. Charles in Waterbury says, can you catch COVID-19 by using sauna baths and steam rooms and jacuzzis?
Again, we don't have any evidence that transmission can occur in sauna baths. Sauna baths operate at a higher temperature, which could make it difficult for the virus to survive for a long time. But we always recommend that you clean the sauna bath very well between users.
Okay. Muzzle in Hartford says, can the virus spread when swimming in lakes and at the beaches?
Again, there is no evidence that COVID-19 can spread to humans through lakes, beaches, or even recreational pools.
Good to know. Dr. Henry Anyimadu, thank you so much. And as we ask you a few more questions here that our viewers have sent in, could I have COVID even if I got a negative antibodies test?
Yes, but it depends on a couple of things. It depends on the test kit that was used and whether you developed antibodies in the first place. And the antibody test that we use around here, it's very good. It's about 98% specific and about 92% sensitive. Majority of people who recover from COVID-19 will have antibodies, but a small percentage may not, especially those that remain asymptomatic. In a small study from China, there were 175 patients who had COVID. 6% did not have detectable antibodies at all, and about 30% have had very low antibody levels. So you can have a negative antibody test even after recovering from COVID-19, but the chances are low.
Okay. And what do you know about patients known as long haulers? What is a long hauler?
So that's long haulers are a very challenging group of patients. They are patients who continue to have symptoms of COVID-19 weeks and months into their illness. They can continue to have fevers, shortness of breath, extreme fatigue, and multiple other symptoms for a long time. It is not entirely new to COVID-19, though. About 30% or 40% of patients who recovered from the original SARS in 2013 had similar prolonged symptoms.
Okay.
But we don't fully understand what happens in long haulers.
Right, and some people are just still struggling. What are considered some early symptoms of COVID-19? And if you have them, are there things doctors can do to treat you early so the disease does not get too serious?
Well, the cardinal symptoms of COVID-19 include fever, shortness of breath, and cough. Some people may have loss of taste and smell, and several other symptoms which we now know of. But more data now suggests that the earlier we treat the virus, the better the response. So it's important to contact your physician as soon as you start having symptoms and get tested. as soon as possible so you can be treated.
Dr. Henry Anyimadu, thank you so much for being with us and answering our viewer questions. We're going to keep doing this because we keep getting so many questions into our newsroom.
It's always a pleasure to be with you.
Thank you.